How to fix facial asymmetry with botulinum toxins. This video is going to cover how to do this with your patients. I think using botulinum toxin to correct asymmetry is both under and sometimes overused with your patients because there are times when it is amazing and other times when it's just not the right thing to do. So let's have a look at the different parts of the face where you can use neuromodulators to increase symmetry. Probably the most common area that patients will ask will be with eyebrows. If you have one eyebrow that is slightly lower than the other, people notice this because they frame your face, and the request to see if you can get them the same is quite common. Now, this can both work out really well, but can also work out quite badly. And I'll share the first experience I ever had treating a patient with an asymmetrical eyebrow was quite complicated because she had trauma to her forehead. So she had injured her forehead at some point in her life, and she had no movement on one side. And this caused her a lot of distress because she had one eyebrow that was actually quite raised and the other one that was completely dropped. And she came asking me to look more symmetrical. And I delivered exactly what she asked for. I relaxed the muscle on the side that was too lifted, and she looked symmetrical, but she absolutely hated the result. And the reason for that is because she went from looking alert and interested, even though she was asymmetrical, to looking exhausted and uninterested. And it's really interesting to think about patients in this way. One of my messages that I hope many of you get from listening to my channel is it's really important to think about the face as a tool for interacting with other people, not just as something that's a picture that needs to become beautiful in a still image. So what she had noticed as a result of her treatment was she preferred the function of her face over the form. It's better to be able to look interested and engaged with people, even if you look very asymmetrical. The key point here is remember that facial symmetry is not the be-all and end-all. Yes, we've all heard it since we were small children that symmetry is beautiful, but it's actually not all there is to it. And many patients will prefer a functioning face with dynamism in it than they will a perfectly symmetrical face if they lose something else. Let's now look at what you can do to adjust eyebrows. The case that I was faced with was hard because there was no way I was ever going to get much of a lift. But if you have more elevation activity, so the frontalis is more active, there is something you can do to adjust eyebrows, but there's very little you can do that doesn't risk then increasing asymmetry in a different way. There are really just 3 injection points that you can do with confidence, and the rest you can do, but you've got to think a lot harder about it. If you remember how to lift an eyebrow generally, the first step and the easiest way to lift an eyebrow is just to put maybe 4 units at the tail of the eyebrow, and this will release the strongest part of orbicularis oculi as it's pulling down the eyebrow and allow for a small lift. And this is the easiest thing you can do. If the patient wants nothing except brow asymmetry, you can do that, and it's very unlikely they will spot anything else because the orbicularis oculi is still working everywhere else, but just at this point it's weaker, and that allows a little bit of a lift in the eyebrow. The step beyond that is to treat underneath the eyebrow, so you're still treating orbicularis oculi, and you're very superficial to keep the eyelid safe. You're over the periosteum, you're over the bone of the orbit, but you can treat maybe 2 to 3 units underneath the tail of the eyebrow, and this releases even more of that muscle, allowing the eyebrow laterally to lift more. The third thing you can do requires a lot more thought, and this is around adjusting the amount of the frontalis muscle that is untreated on one side versus the other side. And this is also a treatment that can cause different asymmetries because you end up with lines on the side that you're trying to lift and no lines on the side that you're not trying to lift. And this obviously causes a different issue, and it's very hard to get it exactly accurate. But if you want to try, it's all about the amount of muscle that you leave untreated. So if you remember the shape that I so often draw in patients when I'm teaching this, which is around how much of the muscle is treated. So we mark out an area where we don't mind treating. We draw the line, we create the vectors that you've seen many times. The size of this triangle that is untreated can be adjusted to give you more lift on one side and less lift on the other. Essentially, the principle is have less treated muscle on the side you want to lift. And if you make small adjustments, you can sometimes get this right, but the downside is you might get an equal lift and more of a lift on one side, but then you have lines and then you've got to solve that with a different problem. So that's why that's the third option, is because it sometimes causes problems later on that then need a different treatment to solve them, either more toxin or maybe end up treating with filler. But it's a little bit trickier than the simpler versions. So that's the eyebrow. Probably the next most common reason that I'm asked to treat asymmetrical faces is actually with quite a rare thing, which is Bell's palsy. So when you have Bell's palsy and it persists, you get a weakening or a decrease in tone on one half of the face and an increase in tone on the other half of the face. And it's actually treating the unaffected side of the face that gets you a more symmetrical result. So where the face is hyperactive and the tone is high, you can use a small amount of botulinum toxin strategically And that actually balances out the tone across the face. And the results can be really amazing. This can be a fantastic result, but you have to think very carefully about which muscles are hyperdynamic. If you ever have a patient with Bell's palsy, try and film them moving and see where you see the additional activity happening. And you'll see one eye is more active. You'll see more of a downturn, usually at the DAO. And these are the muscles that with small amount of toxin, you can treat them and cause an increase in symmetry and balance. Probably the most effective one, I think, is when they have DAO hyperactivity. So they have one side when they smile that actually pulls their mouth down. So this is obviously the opposite of what you're trying to do when you're smiling. This is why a small amount of toxin here makes such a lovely difference to the patient, because they can suddenly then smile normally. I would do it as a normal DAO treatment, but just be very careful about the dose that you use first time. Maybe start with a lower dose and work your way up, because it's not a normal DAO treatment. We're not trying to neutralize it. We're just trying to take away some of that resting tone and the hyperactivity on that side. So 1 to 2 units in the DAO should improve symmetry when the downpull is so obvious. The next area where you might see asymmetry is in the masseter muscle. Often you get one side that seems to be bigger than the other. This is quite tricky because it's quite hard to get this exactly right, but I would simply do a treatment depending on the relative size of the muscle. I would start with a lower dose than I would normally for masseter, because I'm not trying to shrink it to its maximum relaxed state. I'm just trying to cause atrophy that makes it symmetrical. So if you're usually using sort of 24 to 50 units, you can start with less, 20 units, 15 units, and then get the patient back in 6 weeks' time, learn about that response, and then over time adjust it so that it is eventually getting more and more symmetrical. Of course, the other approach is if you think both masseters are hypertrophied, but one side is particularly strong, you can actually just neutralize both of them, because they should return to a similar size, because both of them are completely relaxed in that lower third. So that's another way of thinking about it, which is you don't always have to do asymmetrical treatments in order to increase symmetry, because if you're taking both sides back to a more neutral state, where they're both effectively atrophied as much as they can be, then you're going to be more symmetrical, unless your underlying asymmetry is bone, which does occasionally happen, but I'd say mostly when I've seen it, it's more likely muscle. Another asymmetry which you may occasionally see, and you've probably seen it already in Elvis, is overactivity of the levator labii lecnasi muscle on just one side. So if you have a snarl that's stronger on one side and you wanted to get rid of it, if you want to not look like the king of rock and roll, then 1 unit on just one side is a good first pass. You can always add more. It's very easy to go too far and cause the other problem, a different asymmetry. And that's why small doses are the hallmark of correcting asymmetry. And finally, it's a really good test of your own facial knowledge to try and solve a facial asymmetry problem, even if you don't treat, but really think through what you would do to increase symmetry and what the potential downsides or the ways that you may cause an additional asymmetrical result through over-treating a particular area. And this is also a good thing to place on forums. If you have a support network, put that into the network with your treatment plan and see what other people have to say, because it really makes you think carefully about how all these muscles work. So I recommend you think through it, even if you decide not to do the treatment. So I hope that's helped you understand the anatomy much more deeply. Remember, I've got much more coming on this. Click on the link and sign up for the waiting list for my new anatomy course.